Well, this is a Fox News alert. Puerto Rico declares public health emergency right now over the Zika virus as the Center for Disease Control and the World Health Organization issue new guidelines for this virus. Health officials are now warning men who have traveled to countries active with the virus to avoid unprotected sex. They're also urging countries not to accept blood donations from these travelers either. So what do you need to know about this scary disease?
Yeah, this is big. For that, we turn to Dr. Robert Lahita, Chief of Medicine at Newark Beth Israel Medical Center. Good morning. Thanks for being with us.
Thanks for having me.
This is startling. This is new. We know that Zika can cause severe birth defects for pregnant women once they bear their child. But now it can affect men, too. What do you mean?
Well, it affects men and that men carry the disease. You got to remember that 80% of the people that get this virus will show no symptoms whatsoever. Many of us, about 20% of us, will have muscle aches, joint pains, maybe an inflamed eye, maybe a headache, but you really won't know that you have the Zika.
So the typical symptoms are this, and we'll put these up on the screen here. So you have fever, rash, joint pain, as you mentioned, red eyes, muscle pain, headache. What do we do if we have that? Is there anything we can do if we show signs of this and we're confirmed to have the Zika virus?
What we do is supportive care. The supportive care means we keep you hydrated with fluid. I mean, you'll do this at home. We probably wouldn't admit anybody to the hospital with these signs and symptoms because they're very common. A lot of people have these signs and symptoms. So the differentiation between these symptoms, which are kind of general, and Zika infection are very difficult. So if you have a wife that's pregnant, then you got a problem because now you're wondering whether you're going to infect her. And we know that sexual transmission now is likely. Blood transfusion, sexual transmission, mother to fetus are the ways. And of course, the most common way to get infected is with a mosquito. So if you think you have symptoms, you can, as a mother now, if you think you have symptoms of Zika, you need to get tested.
When this first came out, we were worried about if you were going on vacation to the Caribbean or to Latin America. Right. Now it's here in the United States, and it's not summertime yet when mosquitoes really start to breed right in our backyards.
That's
what do
right.
we need to know heading into those hot, balmy nights?
Well, this is going to be very interesting. We need mosquito control. We are a little bit different than the people of Latin America in that we live in air conditioning. We're very careful to avoid stagnant water. There's going to be a lot of spraying going on with public health authorities to eliminate mosquito growth because the mosquito, remember, is the most common vector for this disease. And this mosquito around our area here in New York State, New Jersey, is the tiger mosquito, Aedes albopictus. And that mosquito can carry this virus. So if you've come back from Latin America and you get bit, you have the opportunity to have that mosquito that just bit you bite somebody else and give them the virus.
Very troubling for a man to travel there on business, to come back with a pregnant wife back home. He doesn't know that he has the symptoms and then transfer that to the baby.
That's
really
right.
Scary. Dr. Bob, great seeing you this morning.
Thanks
nice to see you.
lot.
Thanks so much.
Thanks.